Hey guys, so my topic this week was hyperthyroidism. So first and foremost, we've got our patient here that we're going to be looking at, and then we've got a quick little fact sheet right here as well. So hyperthyroid, what is it? Basically, you have a thyroid and it is overacting. It's really that simple. It's just releasing too many hormones. So your patient's going to come in for an assessment. They might note that they've had some sudden weight loss recently. They've been really moody. Maybe they've had some hand or foot tremors. And a big thing is they're really sensitive to heat. So our patient here, heart's really working overtime. We know the thyroid is what controls your heart rate, metabolism, things like that throughout the body. So she's really hot, she's like moody, she's got this thin brittle hair that's going on. And then there's other couple of symptoms too you might find. So as we're assessing our patient, we're going to gently palpate the neck here, and we're going to notice as we move down that we're going to feel what's called a goiter. So a goiter, right there, is when the thyroid is really inflamed and you can actually feel it. Another thing you might notice too in patients with what's called Graves' disease, very popular in hyperthyroidism, is what's called exophthalmos. So as you can see with our raging lady who's hot and has thin brittle hair, she also has these eyes that are bugging out of her face. So that's due to increased intraocular pressure. So as we're moving on in our assessment, you might also hear bruise in the neck region here, and that's from increased blood pressure, which again relates back to the heart rate, metabolism, blood pressure, things like that the thyroid controls. So we've assessed our patient and the doctor is going to order some labs. So we're going to want to consider our TSH, which is your thyroid stimulating hormone, your T3, and your T4 hormones. So these do different things in the body, but they're definitely all going to be increased because that thyroid is working too hard. So the doctor might also order a thyroid scan. So your patient is going to swallow radioactive iodine by mouth, and what's going to happen is as that thyroid is taking up the iodine, you're actually going to be able to watch and see how it is functioning. So we'll talk about some interventions for these patients with hyperthyroidism. Firstly and foremost, we're going to want to monitor that airway. That's always your first priority. As the swelling, may increase, we want to make sure that they're able to breathe. So definitely monitor that apical pulse, blood pressure, and their temperature at least every 4 hours. They are at risk for what's called thyroid storm. So that's going to be characterized by a high fever, severe hypertension. So even if that temperature goes up just 1 degree, that's going to be something you're going to want to report to the provider because this is a life-threatening situation that can happen really fast. So we're going to want to promote their comfort, going back to their heat sensitivity, make sure the climate in their room is comfortable, it's not 95 degrees in there. Allow them to take like a therapeutic cool shower. That'll help cool them down as well. And then there's also going to be some drug therapy. So we're talking about anti-thyroid drugs rather. So your preferred drug class is thionamides. Your first in line is going to be methimazole, which is the brand name Tapazole. That's the first one because your second one, PTU, is more toxic on the liver, so we don't want to have to put these patients through any more torture. Surgical interventions might have to happen as well if the patient's hyperthyroidism gets too bad. They'll do a thyroidectomy and then they'll just maintain them on synthetic thyroid medication like Synthroid. So first and foremost, again, with that, monitor that airway. We want to listen for laryngeal stridor because that is an emergency. The airway is acutely blocked and we need to have trach equipment by the patient's bed at all times if they are a patient who's coming from that. You're going to want to position them so they're not having any neck extension, discomfort that way. And they're also susceptible to laryngeal nerve damage as well after that surgery. So that's that, hyperthyroid.